Aging with autism. The autism spectrum disorder diagnosis, or ASD, has exploded over the past couple decades, and many healthcare practitioners are beginning to question what happens when this large population of children and young adults with an ASD diagnosis become our future wave of older adults on the spectrum. First, what is autism? ASD is a developmental delay condition that generally affects the ability to communicate and one's behavior. Often it's even paired with repetitive behaviors and restrictive interests. Not all diagnoses of autism look the same, but there are common characteristics attributed to these conditions that exist from mild to severe. Thanks to developmental psychology, we have an evidence-based table that tells us the general biopsychosocial developmental expectations of children and at what age they'll achieve certain developmental milestones. Autism is referred to as a developmental disorder because those with the diagnosis do not develop according to what developmental psychology suggests as a standard progression. Professionals like occupational therapists utilize developmental psychology as a frame of reference by which to practice and therefore treat individuals with ASD. They assess where the child is developmentally and attempt to close the gap by using their education and sensory integration treatment, emotional regulation strategies, and many other techniques. Children with ASD receive interventions based on goals that revolve around function and daily activities. They often have a hard time interacting with peers, so social goals are frequently a focus of therapy. Some even have a difficult time participating in basic activities of daily living, like sequencing the steps to get dressed, or even toileting independently. Typically, we see children with mild to moderate ASD that eventually achieve their milestones in some way or learn how to work around their developmental deficits with the use of compensatory strategies. It is not uncommon to see children struggling with autism become not only functional adults but successful adults. Look at Temple Grandin, for example. She is a well-known contributor to Animal Science, a professor, celebrated author, and a beloved autism spokesperson. Despite her struggles with conforming to typical social behaviors, Temple was not challenged at all by understanding the subjects that fascinated her. In fact, she saw things in ways that many of her academic superiors did not. Unfortunately, those with a more severe form of ASD can have a harder time integrating into society and can end up relying on the assistance of others to various degrees in order to continue participating in activities of daily living. This is an unfortunate reality for many individuals on the spectrum. Parents can unexpectedly become permanent caregivers. So, we have some individuals with ASD that go on to live functional lives, and others who are not so skilled at living independently as adults. Regardless, we know that as all humans age, we experience a natural decline in physical and cognitive function. But how does this decline affect individuals with ASD? Do functional individuals with ASD end up not so functional as they begin to age? And do symptoms simply get worse for those that never achieved independence to begin with? Just as we look to human development to help us work with children with autism, we will look to human development and developmental psychology again to help us understand aging with autism. First, it's imperative to understand what is developmentally normal throughout the aging process for older adults. Starting around the age of 60, our brains begin to lose volume, which typically results in things like slowed mental processing and a decline in memory function. Normally, this does not impair function and only occasionally causes lapse in judgment or brief moments of forgetfulness. So, what kind of experience does this mean that older adults with autism will have? Rebecca Charlton, a senior lecturer at the University of London, discovered through research that one-third of adults with autism report high levels of depression or anxiety, rates much higher than the general public. This is concerning because we know that depression in older adults is a risk factor for experiencing declines in memory and cognition. This means that older adults with autism are at an exceptionally high risk for developing memory and cognitive issues throughout the aging process, and increasingly so as they continue to grow older. A second major issue has arisen according to Professor Blair Braden's research. She believes that executive function skills in older adults with autism will experience a quote, double hit to the system, since it already declines with age and many youth with autism already exhibit diminished executive function skills. So, why is this important to know? According to natural human development, as our frontal lobe grows, we begin to develop skills called executive functions, which include the ability to manage time, plan, and adapt to new environments or situations. So it's obvious as to why experiencing a decline in these skills can negatively affect function. If we are seeing patterns of a worsening of the diagnosis with age, when it comes to developmental deficits that youth with autism experience, then we need to brace ourselves as healthcare professionals and researchers. We need to prepare for treating older adults with autism because they appear to have an increased risk of experiencing a steeper decline in skills than neurotypical individuals. On the bright side, we know that many individuals with autism learn excellent coping strategies to deal with their functional deficits, essentially combating the effects of their condition. We have seen that these skills can be honed and carried over into adulthood. But unfortunately, it's unlikely that compensation strategies alone will be enough to combat the inevitable effects of the aging process. All of this information ends up raising a lot more questions. We learn that aging with autism can be risky while also experiencing other comorbid conditions, like depression. But little is known about too many other conditions and how they'll affect the process of aging with autism. We also learned about how basic executive functions are at risk of declining to the point where function and daily skills may slowly dissipate. It seems as if we continue expanding the knowledge of human development and developmental psychology, then we may begin to better understand how this process will affect older adults with autism. Overall, according to Charlton, it appears as if there will be a general decline in function as adults with autism age and begin to experience older adulthood. The more we try to understand how people with autism develop and change as they age, the more prepared we will be to provide supportive services for them in the future. Thank you.